Hi guys, it's Nicole from the Physio crew and I'm doing a video today on the top 3 causes of headaches and how to resolve them. So headaches seem to be coming into the clinic so much at the moment, and it seems to be because there was a bit of a lack of education that physios can actually help resolve headaches. Often people put up with migraines and headaches that can be caused from muscle tension in the shoulders and the neck, and they don't realise that actually manual therapy, hands-on treatment, exercises and things that help to increase blood flow into those muscles can be very, very effective in helping to resolve headaches. So I had a chap yesterday, just going to use a quick example, had a chap yesterday who came in, he had been working out in the gym and he'd started to get headaches. He had an inkling that it might be muscular. He had suffered from what he thought was sort of migraines before, but actually when I started to talk to him and I asked him about, you know, classic signs of migraines, the different like sensitivity to light, little squiggles in your vision, like other things that are related to migraines. He hadn't actually experienced any of those, and his headaches were very much related to his gym work. So he'd taken like 3 months off after injuring his shoulder, and he was saying since he'd been back, it was just when he was starting to do a lot of work where he was using his upper traps, quite often if he was doing squats, so if he had the bar on, that was causing it. So what we did is we did a full assessment, so we had a look at his range of movement, had a little feel of his joints. So the top 3 reasons that people get headaches, it can be cervicogenic, so cervical just means a posh word for your neck, and often it will happen sort of like at C2, C3, so the highest levels, you'll get a problem with the joint there, and that can cause headaches. The second most likely cause is actually like a trigger point inside the muscle itself, so that can be within the upper trap or it can be in other muscles around there as well. A lot of people don't realise how complex the neck is. You've got your sternocleidomastoid, that can cause sort of pain behind the ear, which sometimes people call a headache even though it's not a traditional headache, but it is at the back here. And sometimes it can be where the upper trap is joining the occiput, which is the bit at the back of the skull, so that can be affected. It can be, the trigger points. It can also be that it can be a postural type thing. So is it because you've got a very forward head posture and then that's putting pressure on the joints there as well? And then we also have to investigate whether it is a non-MSK cause. So we'd ask like top 5 questions. We'd be looking to rule out, because remember that physios are autonomous practitioners, so we are trained that you can come and see us without a doctor's referral, because we have a high enough level of education that we can help to triage and say, right, this isn't a problem for physio, we need to send you back to the GP. So the sort of questions we'd ask with that is, do you get any drop attacks? So do you find that you're just walking along and you fall over and you don't know how you got there? Do you get any diplopia? Do you get any sort of changes in your vision? Do you get any nausea, or do you get any problems with your speech or your swallowing? Because headaches can also be caused by blood insufficiency in the brain, and you've got a blood vessel that goes quite close to the spine, but when the muscles are very contracted it can become blocked. And then there are lots of other kind of weird and wondrous conditions as well, which I'm sure that you don't have, but we can help to work out whether it could be something else. So the things that we look for is the dizziness, the change in the vision, so the black spotting in the vision. We look at dysphasia, which is problems with the speech, or dysphagia, which is problems with the swallowing, and that helps us to understand whether we need to refer you on to see a GP. Now, I rarely have to do that because it's very rarely anything serious, but if we do, we just write you a really nice detailed letter and we say, right, there you go off to your GP, and then they've got all of the evidence. Because I think what a lot of people struggle with when they go to see their GP is they don't know where to start with, and they don't understand the medical knowledge. Whereas if you come into a physio and we say, right, the patient presented with this problem and we found this, this and this on examination, and our recommendation is that you review them because we're concerned it could be X, Y or Z. And that means that when you go into the GP, I mean, GPs have the hardest job in the world. 10 minutes, like I would massively struggle with 10 minutes with my patient. I mean, anyone who's coming to see me knows I'm like, oh yeah, it's a 45-minute slot, but I leave an hour because I talk talk a lot. And that's because it's really important that we get a clear picture. So if you are experiencing headaches, if it's a trigger point related headache, then what you can do is you can do soft tissue release. So you can get like the end of a pencil or a pen and dig it into the trigger point if it's in the upper trap. The way that you know that that's what's causing it is if you actually put the end of the pen onto it and you press it down and it reproduces the headache, then that's a nice, not completely accurate, but we can say, right, okay, if we press here and that recreates the headache, that's probably what's causing it. And then we would look to release it. Now, the thing that people get wrong sometimes in physio, and this is kind of the difference between seeing like a manual therapist, like, I won't say any names, but a different and not a physio, is physio wants to resolve it long term. So if you come and see me and I don't get you better, like that doesn't give me my nice warm fuzzy feeling and like woohoo, like that, I don't like that. I want to see you better long term. But if you're doing something repeatedly that's causing the trigger point, for example, lifting in an incorrect technique, or using a mouse in the wrong way, or sitting, or doing lots of repeated rotation to the same side that you have the trigger point, something like driving, for example, then it's going to come back. So with physio, what the idea is that we're educating you, we're making sure that you take responsibility, because you know, if people who want to come in and just have a quick fix, it doesn't work. Like, anyone who tells you that is not being honest with you. So you have to understand we can definitely help release it, but we're looking at how we change things so that it doesn't come back as well. So if it's a trigger point, you would do the release. If it's cervicogenic, it is really hard for you to do a joint mobilization yourself. What you can do is if you run your hand down the back of your neck, what you'll feel in the center of the spine is sort of like a peak and a trough. So you'll put your finger on the bony bit at the back, and then what often happens with people who have cervicogenic headaches is you'll find that one of the little peaks disappears. Now, do not panic, your neck is not out of alignment. No matter what the other manual therapist has told you, you're not out of alignment, bones don't move like that. It's just that the muscles are pulling in a slightly different way, and that means that you're kind of in a forward head posture. That's putting pressure on the joints at the back, and then that's causing pain. So what you need to do is to find it, and if you can't find it, give yourself like a double chin, like this, and keep your finger on the center at the back, and then what you should feel is the bony bit come to meet your thumb. Now, if, for example, you were driving and you started to get a headache, you could gently pull over and put your finger in the center, see if you can find any that you can't feel very well, and then try to do the double chin to try and feel the bone back. And what you're doing is you're training the muscles to pull your head on top of the spine, because the problem with the head is very, very heavy, and we're really well designed to have our head on top of our spine, and when we're in that position it works really, really well. But when we're too far forward, which despite what you'd think that if the head is forward that it's the muscles pulling you forward, but actually what happens is it's the muscles at the back. So if you imagine I've got a ponytail and you pull my ponytail, what happens is the chin comes forward and you get a forward head posture. So we actually have to stretch the muscles at the back to get the head in the right position. So that's a little bit on headaches, but that's a lot to do with neck pain as well. That doesn't always cause headaches unless you're getting them on the occiput, which is the bit at the back of the skull where the upper trap joins to. I've lost my trail of thought. This is what I mean, I talk too much and then I lose my trail of thought. So we're talking about resolving it. Oh yeah, cervicogenic. So we've covered how to relieve cervicogenic headaches, we've covered how to relieve trigger point headaches, and we've also covered that if it was a headache which was linked to any of those causes that are non-MSK, so those are things that we need to see a doctor for, we would put it all together in a report and then send you off to the GP. Alright then guys, that was supposed to be a 2-minute video. I think I've gone for about 6 minutes, but well done for hanging in for those people that are live. I'll speak to you later. Take care guys, bye, bye bye.